Hello students, welcome back. In our previous class, we studied key epidemiology terms and also learned in detail about AIDS. Today, we are going to continue with some very important viral diseases, dengue, influenza, and other notable ones like COVID-19, polio, rabies, chikungunya, and hepatitis. Dengue fever. Let's start with dengue fever, also called break bone fever because of the severe joint and muscle pain it causes. The disease is caused by the dengue virus, which has four types or serotypes. Infection with one type gives lifelong immunity to that type but only short protection against others. A second infection with a different type can become very serious. The vector or carrier is the female Aedes aegypti mosquito. Unlike the malaria mosquito, symptoms include high fever, severe headache, pain behind the eyes, body ache, and rashes. In severe cases, called dengue hemorrhagic fever, the platelet count drops drastically and plasma leaks from blood vessels. This can cause dengue shock syndrome, which is life-threatening. Ma'am, may I ask a question? Yes, go ahead. Ma'am, why do doctors always say that platelets are important in dengue? Excellent question. Platelets help in blood clotting. In dengue, when platelet count drops sharply, the patient is at risk of severe bleeding and shock. That's why doctors monitor platelet levels closely. Which bites at night? This one bites during the day, usually in the early morning and late afternoon. Symptoms include high fever, severe headache, pain behind the eyes, body ache, and rashes. In severe cases, called dengue hemorrhagic fever, the platelet count drops drastically and plasma leaks from blood vessels. This can cause dengue shock syndrome, which is life-threatening. Now, prevention is mainly about controlling mosquitoes. Since Aedes mosquitoes breed in clean stagnant water, we must not allow water to collect in containers, tires, or coolers. People should use mosquito nets, repellents, and full-sleeved clothes. A vaccine, called Dengvaxia, exists but it is only recommended for people who already had a previous dengue infection. So vector control remains the main prevention method. Next, let us talk about influenza, commonly known as flu. It is caused by the influenza virus, which belongs to the orthographically family. There are three main types. Type A causes severe illness, affects both humans and animals, and is responsible for all flu pandemics. Type B, usually milder, mainly affects children. Type C causes mild, sporadic infections. Now, there are two important concepts in influenza: antigenic drift and antigenic shift. Antigenic drift means small, gradual changes in the virus genes. Because of this, the flu virus looks slightly different every year, and that's why we need a new flu vaccine each year. Antigenic shift, on the other hand, is a sudden, major change in the virus. This creates a completely new virus strain that humans have little or no immunity to. For example, the 1918 Spanish flu, caused by the H1N1 virus, was due to antigenic shift. Ma'am, may I ask a question? Yes, please. Ma'am, if antigenic drift only changes the virus a little, why can't the old vaccine still work? Very thoughtful. Even small changes in the virus surface proteins can make our immune system fail to recognize it properly. So, the protection from the old vaccine decreases and a new vaccine is required. Influenza spreads through respiratory droplets when a person coughs or sneezes. It can also spread through contaminated surfaces like door handles. The best prevention is annual vaccination, along with good hygiene and covering the mouth while coughing or sneezing. The best prevention is annual vaccination, along with good hygiene and covering the mouth while coughing or sneezing. Let's move on to other viral diseases. First, COVID-19 caused by SARS-CoV-2. It spreads through droplets and primarily affects the respiratory system. Diagnosis is usually done by RT-PCR test. Prevention involves vaccination, masks, and hand hygiene. Next is polio. It spreads through the fecal-oral route and can invade the nervous system, sometimes causing permanent paralysis. Prevention is through vaccines, the oral polio vaccine, OPV, and the inactivated polio vaccine, IPV. India's Pulse Polio campaign was a massive drive that helped in almost eliminating the disease. Another important viral disease is rabies, also called hydrophobia. It is transmitted through the bite of an infected animal, usually a dog. The virus travels along nerves to the brain, causing fatal encephalitis. Symptoms include severe throat spasms and fear of water. Prevention includes vaccination of pets and post-exposure prophylaxis (PEP) for humans after an animal bite. Chikungunya is spread by the same Aedes mosquito that spreads dengue. The name means to become contorted, describing the severe joint pain it causes. Hepatitis is inflammation of the liver. Different types, hepatitis A, B, C, have different modes of spread. Vaccines exist for some types, especially hepatitis B. So students, today we completed a discussion on dengue, influenza, and other major viral diseases like COVID-19, polio, rabies, chikungunya, and hepatitis. If we combine this with part 1, you now have a complete understanding of epidemiology and viral diseases. Remember, awareness, prevention, and vaccination are the strongest shields against these diseases. That's all for today.